Nominated by President Obama to serve as the 80th Secretary of the Veterans Affairs, our next speaker will confirm for that position by the U.S. Senate on July 29, 2014. He was previously the Chairman, President, and CEO of the Procter & Gamble Company. Under his leadership, Procter & Gamble added nearly 1 billion people to its global customer base, and its stock increased 60% from 2009 to 2013. A graduate of the United States Military Academy at West Point, he also earned an MBA from the University of Utah in 1978. While some Washington voices have proposals that would ultimately lead to the dismantling of VA, the American Legion is eager to work with the Secretary in demonstrating that VA truly is a system worth saving. So far, the Secretary has expanded veterans' access by focusing on staffing, space, productivity, and community care. Under his leadership, the department has greatly reduced homelessness among veterans. Ladies and gentlemen, please join me in welcoming the Secretary of the Department of Veterans Affairs, Robert McDonald.
Thank you. Thank you very much. I want to thank Dale for his leadership of the American Legion and for that kind introduction. What he didn't say was that he was a year ahead of me at West Point, and I owe him dearly because he allowed me to eat. Let me also recognize Ralph Bozzella and also Verna Jones and thank them for their leadership. We work very frequently with them in Washington, D.C. I'd also like to recognize other members of the Legion's Executive Office, fellow veterans, colleagues, distinguished guests, ladies and gentlemen. Thank you for that warm introduction. Over 2 years ago now, I had my confirmation hearing with the Senate Committee on Veterans Affairs. I was asked then, why do you want to be the Secretary of Veterans Affairs? And I told them, there's no higher calling. There's no more noble mission. When President Obama asked, I didn't hesitate. It's an opportunity to make a difference in the lives of my fellow veterans. At that hearing, I pledged to work to transform the VA, improving access to high-quality care and benefits that veterans have earned and that they deserve. And I pledged to work with Congress, with our veteran service organizations, and with other stakeholders. After confirmation, my first stop was Phoenix, and then Las Vegas, Memphis, Reno, Palo Alto, and Charlotte, and many more. Across 23 cities, I consulted thousands of veterans, VA employees, veteran service organization leaders. The American Legion was one of the very first. We talked about how could we shape our My VA transformation strategy so that VA would best serve veterans. Here's the point. My VA is not my strategy. It's yours. It's not about me. It's about all of you. It reflects your ideals, your insights, and your innovations. Now, you've heard many times that VA is broken. Well, I disagree. We have challenges, yes, but VA can be transformed. In fact, transformation is well underway, and we're already seeing results. Changing VA means changing leadership. 14 of our top 17 executives are new since I became secretary. These are world-class, enthusiastic leaders, business leaders, and healthcare professionals. 8 of them are veterans themselves. And since March of 2015, our new My VA Advisory Committee has been hard at work. Committee members have brought extensive experience in customer service and in organizational change. They're leaders in business, in medicine, in government, and in veteran advocacy. Among them are veterans like Major General Joe Robles. After 30 years in the Army, Joe was president and CEO for USAA. Another is Dr. Richard Carmona. He's a Special Forces Vietnam veteran and was the 17th Surgeon General of the United States of America. Another is a Navy veteran, Dr. Connie Mariano, who was the first woman to serve as White House physician to the President, the first woman director of the White House Medical Unit, and the first Filipino-American in U.S. history to become a Navy Rear Admiral. These are innovative, resourceful, respected leaders who are advising us on our transformation. They know business, they know customer service, and they know veterans. It's important you know that we're collaborating with world-class institutions like Johnson & Johnson, USAA, Starbucks, NASA, Kaiser Permanente, Hospital Corporation of America, Virginia Mason, Marriott, and Ritz-Carlton, and many more. It's important that you know that we've partnered with respected organizations like the YMCA, the Elks, the PedFed Foundation, LinkedIn, Coursera, Google, Walgreens, academic institutions, other federal agencies, and many, many more. Over the last 2 years, we've partnered with local leaders to help build a new national network of 76 Community Veterans Engagement Boards, or CVEBs for short. CVEBs are partnerships that leverage community assets as well as VA assets to help ensure we implement local solutions to meet veterans' needs in our communities. Our goal is 100 CVEBs across the country by year's end. If there's no CVEB in your community, let's help make it happen. Partnerships are the foundation of our progress in ending veterans' homelessness. VA, working with the Department of Housing and Urban Development and the United States Interagency Council on Homelessness, businesses, criminal justice system, mental health, nonprofits, local elected officials, community providers, local VSOs, faith-based community, and philanthropists, to name just a few, are close to our 4,000 public and private partners helping us better meet veteran needs. We launched our 25 Cities initiative in March of 2014. A few months later, First Lady Michelle Obama announced the Mayor's Challenge to end veterans' homelessness. Over 880 mayors, governors, county and city officials accepted the challenge to end veterans' homelessness. These partnerships are why 28 communities in 2 states have already achieved an effective end to veterans' homelessness. And they're why over 360,000 veterans and family members have been housed, rehoused, or prevented from falling into homelessness since 2010. In Los Angeles, the worst city in the country for homelessness, we cut veteran homelessness by more than 30% last year. That's about 4 times the rate of decline of the previous years. Veteran homelessness nationwide is down by 47% since 2010. We virtually cut it in half. New leadership, innovative collaboration, expanded partnerships, all of that matters. Now let me talk about VA healthcare. You know VA is the largest integrated healthcare system in the country. We have a unique lifetime relationship with our 9 million patients and a single electronic healthcare record across the entire enterprise. Nobody else in medicine offers that. Our mental health care is integrated with primary care, with specialty care, and with psychosocial support to minimize barriers and help resolve problems early. Nobody else offers that. VA healthcare is whole veteran healthcare, body, mind, soul, customized to meet the individual veteran's need. Yoga, acupuncture, sports therapy, music therapy, writing and art therapy. We validate and embrace what works to heal veterans. And VA care is integrated with non-medical determinants of health and well-being that other people often miss. I'm talking about things like education services, career transition support, fiduciary services, pension resources, disability compensation, and many, many others. Nobody else offers all of that. And our Undersecretary of Health, Dr. David Shulkin, is changing our system to proactive, holistic health care and wellness. Let me talk about access to VA health care. You should know that more veterans are coming to the VA for our care and waiting less time. Last year, veterans had nearly 4 million more appointments than the previous year. Almost 57 million more were in VA facilities, and over 16.8 million more were VA care in the community appointments. Last March, veterans set a record for completed appointments, 5.3 million inside VA, 730,000 more than March of 2014. Last March, VA issued 268,000 authorizations for care in the community, twice as many as we did in March of 2014. In July, 96% of appointments were completed within 30 days of the veteran's desired date. 85% were completed within 7 days, and 22% were completed the very same day. You should know that the average wait time for primary care is around 5 days, 6 days for specialty care, and 2 days for mental health care. And by December, get this, by December, you can expect same-day access to primary care and same-day access to mental health care. I gotta tell you, nobody else offers that. By the way, VA is the only healthcare system that publicly reports on wait times as a measure of access. 90% of veterans we surveyed are satisfied or completely satisfied with the timeliness of their care. Now, we won't be satisfied until we hit 100%. So we're making important progress, but you rarely hear about that in the media. You'd never know we lead in many fields of research that benefit all Americans, not only veterans. Post-traumatic stress, traumatic brain injury, spinal cord injury, prosthetics, and genetics. You'd never know the American Customer Satisfaction Index rated your National Cemetery Administration #1 in customer service 5 years running. You'd never know J.D. Power rated your mail-order pharmacy best in the country in customer satisfaction 6 years running, better than Walmart, better than CVS, better than Walgreens. Not too long ago, all you heard about was the backlog of disability claims, 611,000 claims, more than 125 days old. So we added staff, we adjusted policies, and importantly, we designed an automated claims processing system. Today, that backlog is down almost 90%. The average time waiting for a completed claim is down 65%. That's the work of industrious employees and leaders, many of them veterans, but you never read about that. Listening to some people, you'd never know there's a decent person working at the VA, veteran or otherwise. Well, these last 2 years, I've met and talked with thousands of VA employees and leaders in over 330 locations, many of them veterans just like you and just like me. They're people like Kathy DeNoble, a nurse with our DC home-based primary care office. Every Thanksgiving and Christmas, Kathy takes a holiday dinner to a veteran she cares for who served in Iraq. He was a guard at Abu Ghraib. He's suffering severe post-traumatic stress, and he doesn't get out of the house much. Chuck Malden's an emergency room nurse at the Salisbury, North Carolina VAMC. One day, Chuck was treating a veteran for blisters, and he literally gave the veteran the shoes off his feet. Why? Because the veteran needed better shoes. Because Chuck cared. Because that's what VA is all about. Our employees are good people. I'm proud of them. No, they're not all perfect. They're not all perfect. But it's a gross misrepresentation to cherry pick the worst and hold them up like they represent every VA employee. Just like it's a gross misrepresentation to take a VAD veteran and hold up a VAD veteran to represent all of us. It's a distortion that sells papers, but it's a distortion that hurts veterans and it hurts the good people caring for them. Some claim that there's no accountability at the VA. You don't think we hold people accountable? Well, tell that to the VA employee in Augusta, Georgia, recently convicted of falsifying health care records. He's facing sentencing that could include years in prison and hundreds of thousands of dollars in fines. All told, we've terminated over 3,755 employees in 2 years. Now, some people will think everything will be fine if we simply fire more people more quickly. But that's just not true. We can't fire our way to excellence. Over my 33 years in the private sector, I've never encountered an organization where firing people was a measure of leadership. We won't punish people based on opinions, recycled and embellished media accounts, or external pressure. It's not in the best interest of the veterans we serve. Excellence is what we're after. So the right dialogue is about forward-looking leadership and sustainable accountability. Sustainable accountability gives you positive outcomes. That's leaders and supervisors providing routine feedback, just like in a well-led, well-trained military outfit. It's recognizing what's going well, coaching and retraining when improvement's necessary, ensuring employees understand how daily work supports our mission, our values, and our strategy. It's training leaders to lead and employees to exceed expectations every single day. And it's taking corrective action when it's warranted and supported by the evidence. These are pretty simple concepts for veterans, for you, for me. These are the same principles that built the greatest fighting force in the history of the planet. We're serious about the work we're doing for you, and we have the opportunity to look back at 2016 as the year that VA turned the corner for veterans. But there are some things we can't do without the help of Congress. The Senate Appropriations Committee approved a budget nearly equal to the President's request. But the House proposed a $1.5 billion reduction in that budget. Now that will hurt veterans, and it will impede the critical initiatives that we need to transform the VA into the high-performing organization you deserve. Now you should know that there are more than 100 legislative proposals in the President's 2017 budget. Many are vital to maintaining our ability to purchase non-VA health care. Only Congress can modernize and clarify our purchase care authorities to streamline access to community care programs in the year ahead. We submitted our plan last October, but we need congressional action to execute it. Only Congress can enact legislation so we can better compete with the private sector, get the best medical professionals to choose to serve you at the VA. And perhaps most importantly, only Congress can modernize the archaic appeals process. Last year, the board was adjudicating an appeal from 25 years ago. Under the current law, with no significant change in resources, the number of veterans waiting a decision will soar by 179% by 2027, from 500,000 to nearly 1.3 million. So, with the help of the American Legion and other veteran service organizations, the National Association of State Directors of Veterans Affairs, and the National Association of County Veteran Service Officers, we shaped a simplified, streamlined, and fair appeals process. It's your plan. Your commander knows this, and he knows it needs to get done, and he's been working on it. Just a few days ago, your commander sent out a call to action on this very subject to the members of Congress. Thank you, Dale, for joining us and urging Congress to pass this new law. In 5 years, we could have appeals resolved within 1 year of filing. The legislation costs nothing, and it will be more efficient and even less costly over time. What's the alternative? More resources dedicated to a broken system. Veterans waiting 10 years for a final decision on their appeal. Now that's unacceptable to me, and I know it's unacceptable to you. Please join Dale and all of us in VA in getting Congress to act in order to better serve veterans. Call your members of Congress. Call your members of Congress. Visit their offices while they are home campaigning. Write them a letter. Tell them to act on our proposed legislation and get some good things done for veterans. All these proposals require congressional action, and you can help us get it done. It was 95 years ago, VSOs helped bring the Veterans Bureau into existence. 9 years later, you helped create the Veterans Administration. You helped get us the GI Bill, the Montgomery GI Bill, and the post-9/11 GI Bill. You're why President Reagan made VA a department, a member of the cabinet, giving us a seat at the table of national affairs. And you're the ones who can keep veterans in control of how, when, and where they wish to be served. And that's what my VA is all about. You're hearing lots more recommendations about VA's future. Some come from non-veterans. Some come from different people with different political ideology. Some have argued VA can best serve veterans by shutting down VA health care altogether. Now, I suspect that proposal serves some parties somewhere pretty well. But that's not transformational. In my mind, it's more along the lines of dereliction of duty. It doesn't serve veterans well, and it doesn't sit well with me. So make sure there's substance to these discussions, and that they're about veterans' interests and not something else. Make sure they're anchored to the service and the sacrifice, the sense of duty and honor that veterans represent and only veterans understand. It's your VA. It always has been. May God bless you, your families. May God bless the veterans of this country, and may God bless the United States of America. Thank you very much.
Mr. Secretary, thank you so much for updating us, and also I want to thank you for giving me the opportunity on May 11th when I was invited to testify before that reforming committee of my VA to give the input of the membership of the American Legion and to be able to have a voice as a veteran service organization, and making our VA better. So thank you, Mr. Secretary, for that.